Hey, this is Dr. Roberson. I want to go over some instructions on exercises after your hip and knee replacement. This is something you'll be given the instructions before you're discharged from the surgery center or the hospital. And so these are things that we want you to do. So I want to demonstrate it for you, and you can watch this video every day if needed for a reminder. So the first thing I want you to do is walk every hour. This is not a long walk. This is not going outside and walking down the driveway and back up or going down the road. This is a simple walk around the house. Usually you can walk to the bathroom or the kitchen. One example is to go to the kitchen and set your timer for 60 minutes on either your oven or your microwave. This will remind you when you need to get up again in another hour. I expect you to do these 10 times a day, so hourly for 10 times each day. So after your short walk, you will come back to your living room or recliner or chair and begin the exercises. So the first exercise is ankle pumps. So an ankle pump, a real ankle pump, is push down and hold it for a count of 3. It's not this, it is pushing down, 1, 2, 3, relax. You should be able to see your muscle when you push down. 1, 2, 3, relax. You're going to do this 10 times. This does 2 things. 1, it helps prevent blood clots by pushing the blood out of the vessels. And 2, it will help decrease your swelling by the muscles contracting and pushing the fluid back up the leg. So again, 10 of these for a count of 3. If you're a hip replacement, you're done. You've walked and you've done your ankle pumps. Now it's time to elevate your leg and ice the hip. For the knees, you have 3 more exercises. So the first exercise, there's 2 ways to do this. One, as the directions show you that we've given you, is to lie flat on your couch or a bed and to try to straighten your leg. You can pretend there's an egg or a ball underneath it and you're trying to crack the egg or squish the ball. So you'll do this for a count of 3. 1, 2, 3, relax. Now, this will not be very comfortable. Your hamstrings will be tight. Many of you cannot straighten your knee flat. By straight, I mean flat. Cannot flatten your knee completely before surgery. Usually during surgery, we are able to get you to a flat position, but your hamstrings are not going to be happy. So this will be somewhat sore and painful. Another way to do this is to get an ottoman or a stool and sit your leg straight on it like this, and then push down for 3. 1, 2, 3. Again, this will not be comfortable, but it's important to help reach full extension. At this point, you will relax again and do for 2 to 3 seconds, and then again. So 10 of these. All right, so after you've worked on your knee extensions, you're going to work on the heel slides, butt slides, lots of different names for it, but basically bending your knee. So sitting in a chair, you will bring you'll bring your foot as far back as possible. When you get to that position, hold it, and then slide your booty out. And so you're working on the angle here. 90 degrees is like an L. That's the goal. So if you get to just shy of that, you stop and you push your booty out, or if you have a rolling chair, push it out and hold it. 1, 2, 3, relax. Kind of shake it out and do it again. Again, because of swelling, this will not be comfortable, but it's important to get your motion back. So slide it out, 1, 2, 3, relax. So 10 of these. After you've done 10 of these, I want you to go back to the knee straightening, either on a stool or an ottoman, and let your knee just hang straight. Don't pressure, don't want anybody pushing on it. You just want to let it sit there straight for 5 to 10 minutes. You can ice it at this point if you'd like as well, but the main thing is just to let gravity pull, and it'll help relax the hamstrings, and over time this will get easier and easier. So after you've done that for 5 to 10 minutes, then it's important that you elevate. So if you're a knee, but hips as well, your toe above your nose, lying flat or back, elevated, and ice. So I want you icing it for 30 to 40 minutes during this time. Once the buzzer goes off, you repeat. So this is 10 times a day. If you do this for the first 7 to 10 days, this will greatly decrease your chance of a blood clot as well as pneumonia. It will also help you return to function faster and decrease your swelling and pain. The goal of this is to need less narcotic pain medications as well as the ibuprofen and Tylenol. Take them as needed, but this will help return you faster to your normal activities.